Knock knock. Dog. I had this injury last night when I fall to the 3 step of my stairs at home. So they prescribed me to have an X-ray immediately because there's a swelling on my right hand. Can you please check the X-ray?
I see. Okay, let's check your X-ray. So, basing from your X-ray, you had a fracture on your right wrist, specifically on your radius, one of the bones of your wrist, of your forearm. But there's no bone displacement. So, surgery is not necessary, but you need orthotics to stabilize the structure. So, I'll refer you to the PT department for further evaluation and orthotic fitting.
So I have another concern about my knees. When I'm waking up in the morning, it seems that I can't get up the bed for 20 minutes, and after that, I will feel better and be able to walk. But I'm concerned about my knee pain.
I see. Do you have any underlying diseases?
My parents had osteoarthritis.
So, sir, I'd like you to step here so that we can measure your weight.
Okay.
Okay. I see that your weight 200 pounds.
And I guess my height is 5 feet and 8 inches tall.
So, comparing to 200 pounds, I think you're obese, sir. So, sir, may I ask you to lie down so I can examine your knee? Sir, so just relax, ha? Okay. The other side. Okay. So, sir, I see that you have crackages on your knee. Is the creaking sensation under your knee. So that's indicative of osteoarthritis. So, okay. I'll also examine the alignment of your knee. So, okay, so you're positive on ginovarum, you have slight ginovarum. Ginovarum is one of the complications of OA. So it is the outward displacement of your leg to your knee, giving your knee an outward angle. So it is due to the fact that the cartilage on your inner knee are degenerated or withered away, causing the weight to be abnormally shifted to the lateral side and thus outward displacing your leg, causing the knee to have an abnormal alignment. So, sir, can I ask you to stand and walk for me? Okay, sir. Let's get back. So, sir, I see that you're feeling pain with your hip.
Yes.
So that's called antalgic pain. So it's also a problem caused by osteoarthritis. It's because of the fact that the cartilage between your joints in your knee are degenerated. There's nothing to cushion the force causing pain. So that's why your walking is impaired.
According to your radiographic findings, there is a narrowing of your joint space on the medial side of your knee joint, and there are also mild osteophyte formation, which are indications of osteoarthritis.
The distal radius is one of the most common sites of fracture among the elderly. The distal radius articulates with the scaphoid, lunate, and the distal ulna. This structure is responsible for 80% of the axial loading. The mechanism of injury for the distal radius fracture is usually whoosh, fall onto an outstretched hand. It can also be caused by other mechanisms that induce higher load. A Cole's fracture may result from direct impact to the palm, like if you use your hands to break up a fall and land on the palms. There is a distinct bump in the wrist similar to the neck of the fork. It happens because the broken end of the distal radius shifts up toward the back of the hand. The knee complex is one of the largest and most complex joints in the body. The knee joint is one of the strongest and most important joints in the human body. It allows the lower leg to move in relation to the thigh while supporting the body's weight. Movements at the knee joint are imperative to various activities of daily living. It includes walking, running, sitting, and standing. The knee consists of two joints. The tibiofemoral joint, which is the articulation between the femur and tibia, and the patellofemoral joint, which is the articulation between the femur, kneecap, and the kneecap or patella. Osteoarthritis, or also known as degenerative joint disease, is the most common form of arthritis. It is primarily disease of cartilage, not of the synovium, unlike rheumatoid arthritis. It is a slowly progressing articular disease that appears to mainly affect the articular cartilage and articular surfaces of the bone, causing abnormal disruption of forces and weight within the joint. Knee osteoarthritis in particular is considered the leading cause of disability in the elderly population. One of the long-term complications of knee osteoarthritis is varus deformity of the knee joint, causing an abnormal disruption of the weight-bearing stresses within the joint. Particularly, the stress is concentrated medially, which hastens the degenerative changes in the medial compartment of the joint.
For the clinical manifestation of the distal radius fracture, number 1, pain on right wrist. Number 2, swelling on right wrist. For the clinical manifestation of the knee osteoarthritis, number 1, mild genu-varum on both knees. Number 2, positive antalgic gait. Number 3, positive palpable crepitus. The utilization of orthotics will benefit the case of the patient by number 1, orthotics will provide stabilization on right wrist, thus preventing further damage. Number 2, orthotics will aid the presenting antalgic gait of the patient. Number 3, orthotics will suppress the progression of the knee deformity. Number 4, orthotics acts as a supporting material to assist in weight-bearing activities, thus hampering the progression of knee osteoarthritis. For the orthotics prescription, a volar cock-up splint is prescribed for the distal radius fracture of the patient. Rationale, number 1, to immobilize the fractured wrist. Number 2, to reduce swelling. Number 3, to promote bone and tissue healing. Number 4, to prevent further damage on surrounding tissues. Number 5, to maintain finger range of motions. For the knee osteoarthritis, a knee unloader brace is prescribed for the patient. Rationale, to provide pain relief on both knees. Number 2, a 3-point leverage system to reduce pressure inside the compartment. Number 3, to minimize swelling. Number 4, to help suppress the progression of the knee deformity. Number 5, to slow disease progression of knee osteoarthritis. There are 4 phases of orthotic management. 1. Pre-orthotic examination. 2. Orthotics prescription. 3. Orthotics delivery. 4. Orthotics training. For pre-orthotic examination, joint mobility, PT will perform range of motion using a goniometer on both knees towards flexion and extension to determine the loss of motion on both lower extremities. PT will perform passive range of motion to assess if there are abnormal end feels on both knees. For anthropometrics, PT will use figure of 8 measurement using a tape measure to assess the swelling on the right fractured wrist and both knees of the patient. For muscle function, PT will perform manual muscle testing on knee flexors and extensors of both lower extremities to assess muscle strength and determine the appropriate material to use for the orthosis. For sensation, PT will perform pinprick and light touch testing on right forearm, right hand, and both knees to assess the skin sensitivity of the patient and avoid skin irritations when using an orthosis. Orthotics prescription. For the analysis and evaluation of examination, to protect and immobilize the fractured wrist, a volar cock-up splint is prescribed to the patient. To address and prevent the progression of the mild genovarm deformity of the patient, a knee unloader brace with lateral knee pads are prescribed to the patient. For the measurement of orthotics device, PT will measure the involved structures to properly give the correct measurement of the orthosis for the patient. Orthosis delivery. For orthotic fitting, patient is seated on a chair while being fitted with the prescribed orthosis providing the correct measurement. For static examination, PT will assess the patient while standing using the prescribed orthosis from maximal to minimal to no assistance. For dynamic examination, PT will assess the patient inside parallel bars while walking using the prescribed orthosis. Orthotics training. For proper donning and doffing, PT will educate the patient on how to properly wear and take off the orthosis. For proper care, PT will educate the patient on how to properly take care of the orthosis and avoid damage. PT will tell the patient to keep the splint dry and clean. For patient education and instruction, PT will tell the patient to elevate the wrist and hand above the level of the heart whenever possible. PT will tell the patient to maintain finger motions to avoid stiffness.
So good day, I'm Mr. Ulit and I'm the one who will explain the parts of our orthosis. So we have here the thigh shell, here, okay. Thigh shell, the varus or valgus angle adjustment, here. So the calf shell, here. The thigh strap, the quick release buckle, here. The strap number 2, the hinge, strap number 1, and lastly the strap number 3. And we have here the silicone coated neoprene pads and the knee stops. So let's begin with the silicone coated knee stops. So silicone coated neoprene pads provide the best grip and promote brace suspension. Right? So next, the knee stops. So stabilizing mechanisms in the knee joint to secure an unstable knee. So there are different types of knee joint locks. So as you can see here, it is a different flexion extension degree style. Okay. So next is the thigh shell. Okay. So thigh shell, thigh shell. Wait. Thigh shell. So thigh shell, it helps to secure the thigh strap and strap number 2. Again, it helps to secure the thigh strap and strap number 2. Next, the varus valgus angle adjustment. Here. So it adjusts the hinge with hex wrench for minor adjustments. So it depends on the varus valgus deformity of the patient. Okay. So next is the calf shelf here. Calf shelf. The cuff shell, it helps to secure the strap number one. Helps to secure the strap number one around the cuff. Okay. So next is the thigh strap. So thigh strap, it holds the whole thigh in place with the help of strap number two and thigh shell. Again, it holds the whole thigh in place with the help of strap number two and thigh shell. Next, the quick release buckle. Here, the quick release buckle. So it is the device used for fastening two loose ends, with one end attached to it and other held by a catch in a secure but adjustable manner. Again, it is a device used for fastening two loose ends, with one end attached to it and the other held by a catch in a secure but adjustable manner. Okay, so next the strap number two. Here, so it supports the thigh strap to secure the thigh shell in place. Again, it supports the thigh strap to secure the thigh shell in place. Next is the hinge. Hinge. So in this part, you can take off the existing stop and insert new plug-in stops, which are desired flexion extension degrees. And so we have the different knee stops. Okay. So next, the strap number one. It secures the calf muscles. And lastly, the strap number three, it secures the lower calf muscles. Okay. So next, the next orthosis is the volar cock-up splint. So the volar cock-up splint, the function of the volar cock-up splint is to immobilize the wrist joint for limitation of movement, pain help, joint arrangement, functional support, and or positioning for heel. So the volar wrist cock-up orthosis is ideally created with a thermoplastic fabric that features a high degree of comfortability. So to guarantee a near fit. Okay? So I know it will benefit the patient because it is easy to fabricate. It ensures the protection of the patient. It allows functional activities and the firm support of the wrist. So that's it for me. Again, I'm Mr. Ulit and thank you.